Welcome back, guys. Now let's discuss about the Renin-Angiotensin-Aldosterone system, that is RAAS pathway. RAAS. Okay, RAAS pathway. Now, first of all, when do you need this RAAS pathway in your body? Okay, see, first of all, the basic concept is RAAS pathway increases the BP. Okay, RAAS pathway is going to increase your BP. Okay, it increases the blood pressure. So, when do you need this RAAS pathway? So, whenever the person is going into the hypotension, or whenever the person's BP, whenever the mean arterial pressure is going down, so this RAAS pathway is activated. Okay, how it is activated, we'll discuss now. Okay, so now let's start with the first problem. The problem is low BP. Okay, just make a correction. Yes, BP is less. Okay, the BP is less. Now, whenever the BP is going down, now this activates, okay, juxtaglomerular cells. Okay, juxtaglomerular cells are activated. Now, if you ask me, how they are activated, sir? So, whenever the BP goes down, okay, baroreceptors are activated in the body. Okay, the baroreceptors are activated in the body. See, all the time, the BP is monitored by baroreceptors. Okay, now BP, the mean arterial pressure. Okay, the BP is monitored by baroreceptors. Baroreceptors. So, now whenever BP is going down, yes, the baroreceptors are activated. Now, the baroreceptors give this information to the central nervous system. Yes, the BP is falling, BP is falling. Now, when your BP is falling, so in order to increase the BP, what happens? The sympathetic nervous system is activated. Okay, so now what happens? Sympathetic nervous system is activated. Now, we all know what is the sympathetic receptor which is present on the kidney. Now, on the juxtaglomerular apparatus. What is this juxtaglomerular apparatus? We'll discuss later. But now, just trust me, there is this one apparatus called as juxtaglomerular apparatus. Now, on this juxtaglomerular apparatus, there are these cells called as, there are this receptor called as beta-1 adrenergic receptors. Okay, beta-1 sympathetic receptors. On the juxtaglomerular cells or on the juxtaglomerular apparatus, now beta-1 receptors are present. What happens? Now, BP is going down. Okay, BP is going down. Baroreceptors are activated. Now, baroreceptors are activated means now central nervous system is going to activate the sympathetic nervous system. Now, sympathetic nervous system is going to release what? Sympathetic nervous system is going to release catecholamines. Norepinephrine is releasing. Now, this norepinephrine, what it will do? Now, this norepinephrine is going to activate the beta-1 receptors. Now, when the beta-1 receptors are activated, now what happens? Now, these juxtaglomerular cells, now they will release renin. Okay, so this is how renin is produced. So, renin is produced by juxtaglomerular cells. Now tell me, juxtaglomerular cells have which receptor, which sympathetic receptor? Beta-1 receptor, beta-1 adrenergic receptor. Now, okay, what this renin is going to do? At the end of the day, this renin should have to increase the BP, How it will happen, sir? Now, this renin is going to convert this one protein in the blood, which is called as the angiotensinogen. Angiotensinogen is all the time there in the blood. Okay, it's all the time there in the blood. Angiotensinogen is there in the blood. Who is producing this angiotensinogen? Angiotensinogen is produced by the liver. Okay, it's produced by the liver. It's all the time there in the blood. Now, this renin, it's an enzyme. Okay, it's an enzyme. It's going to convert this angiotensinogen into angiotensin 1. So, renin converts angiotensinogen into angiotensin 1. Now, what this angiotensin 1 will do? Now, this angiotensin 1 is there in the blood. Via blood, it will reach the pulmonary capillaries. It will go into the lungs. Okay, now it's there in the pulmonary capillaries. Now, in the pulmonary capillaries, there is an enzyme present which is called as angiotensin-converting enzyme. Okay, so there is this enzyme present called as angiotensin-converting enzyme. Now, this angiotensin-converting enzyme in the pulmonary capillaries, it is going to convert angiotensin 1 into angiotensin 2. Okay, angiotensin 1 into angiotensin 2. Now, what this angiotensin 2 will do, sir? Now, this angiotensin 2, it will act on the blood vessel. See, in the name itself, it's there. Angio means blood vessel, tensin means like, it's something, it's doing constriction. So, it's going to cause the vasoconstriction. Now, we all know whenever the blood vessel constricts, whenever the blood vessel is undergoing constriction, what happened to the BP? BP increases. So, problem is solved or not? Yes, the problem is solved. Now, in the condition of hypotension, whenever the BP is going down, you have to increase the BP. Okay, so this is how angiotensin 2 is going to increase the BP. Not only that, this angiotensin 2 will also act on the adrenal gland. Okay, the angiotensin 2 not only acts on the blood vessel, it also acts on the adrenal glands. Okay, now here I want you to know. See, this is the adrenal gland. Okay, here is the adrenal gland. Now, adrenal gland have how many parts? Now, adrenal gland is anatomically divided into two regions. One is adrenal cortex, the outermost part, and the adrenal medulla. Adrenal medulla, which I am showing you here in this little violet color. Okay, now this is the adrenal medulla. Now adrenal medulla have its cells, adrenal medulla have chromaffin cells, and they are going to produce adrenaline, noradrenaline. Okay, that's okay, that we will discuss later. But right now, what I want to put into your mind is, see, this adrenal gland is having cortex. Now this cortex is divided into 3 regions. Okay, the names are GFR. See, this is outermost cortex, this is little inside, and this is the innermost area. So the cortex is actually divided into 3 regions, which are called as G, F, R. So what is this GFR? Simple. Zona glomerulosa, zona glomerulosa, zona fasciculata, and zona reticularis. So the cortex is divided into 3 zones. Okay, zona glomerulosa, zona fasciculata, and zona reticularis. Now this zona glomerulosa, it produces, okay, upon stimulation, this zona glomerulosa produces mineralocorticoids. Okay, it produces what? It produces mineralocorticoids, MC, mineralocorticoids. Zona fasciculata, it produces glucocorticoids, and zona reticularis, it produces sex corticoids. Okay, but anyway, we will discuss about the adrenal gland later. Now, please concentrate here. So, whenever there is angiotensin II, it's causing the constriction of blood vessels, it increases the BP. Okay, now not only that, this angiotensin II will come now. See, this angiotensin II, it's going to act on the adrenal cortex. Now, this angiotensin II, it acts on the zona glomerulosa. Now, under the influence of this angiotensin II, the zona glomerulosa is going to release mineralocorticoid. What is the name of that mineralocorticoid? Aldosterone. So, this is how aldosterone is produced. Angiotensin II stimulates the adrenal gland. It stimulates the zona glomerulosa, helps in production of aldosterone, which is a mineralocorticoid. Okay, so why we are calling it is a corticoid? Why? Because it's a corticosteroid. It is a steroid hormone. Okay, it's a mineralocorticoid. It's a steroid made out of cholesterol. Okay, it's derived from the cholesterol. That's right, corticoid. Okay, these are steroids. So aldosterone, why we are calling it as mineralocorticoid? Okay, mineralocorticoid. See, corticoid because it's coming from the adrenal cortex and it's a steroid hormone which is derived from the cholesterol. Okay. Now, why it is called as a mineralo? Why? Because it is associated. Okay, it is concerned with mineral metabolism. Which mineral metabolism? Sodium. So, this aldosterone, what it will do? Now, this aldosterone will help in reabsorption of sodium. Okay, aldosterone will act on the nephron. Now, nephrons will reabsorb more and more sodium into the body. Okay, now what happens if more sodium is getting reabsorbed into the body? Wherever sodium goes, water follows. Now in the blood there is more sodium is there. Now the sodium will attract the water from the tissues. Now what happened to the blood volume? Blood volume increases. Now when blood volume increases, automatically blood pressure increases. So this is how aldosterone, by reabsorbing the sodium, increases the BP. Even your mother knows, when you take salt, your BP increases. So aldosterone, by increasing the sodium reabsorption, okay, increases the BP. So this is how, okay, this is a brief thing, okay, this is a brief way to understand the renin-angiotensin-aldosterone pathway. Okay, so renin-angiotensin-aldosterone pathway, the main goal is to increase the BP. Now here, see, imagine there is this one person where the RAAS pathway is overactivated. Now if the RAAS pathway is overactivated, what happens? BP will be more. The patient is going to have hypertension. Now in such patients, okay, now you are having a patient who is having hypertension. So you are going to treat his problem by giving antihypertensive medications or antihypertensive drugs. Now by understanding this pathway, how can we decrease the BP? Okay, how can we decrease the BP? See, by giving drugs like ACE inhibitors. Okay, if you use drugs like ACE inhibitors, when you use ACE inhibitor, now ACE enzyme, this enzyme, angiotensin-converting enzyme is inhibited, so that there is no angiotensin II. If there is no angiotensin II, vasoconstriction is not there, BP decreases. This is one way. Or you can use drugs like aldosterone receptor blockers. Okay, now this aldosterone, what it will do? It helps in sodium reabsorption. Now aldosterone acts on its receptor, right? Aldosterone will act on the nephron. Aldosterone will act on its receptors. Aldosterone have intracytoplasmic receptors, but anyway, aldosterone acting on its receptor helps in sodium reabsorption. But if you give drugs like aldosterone receptor blockers, ARBs, aldosterone receptor blocker, okay, sartans, tell me sartan, candy sartan, like these sartans, valsartan. Now when you use these drugs, what happened? Now aldosterone cannot act on its receptors, no sodium reabsorption. So what happened to the sodium reabsorption? Sodium reabsorption decreases, blood levels of sodium decreases, So automatically BP decreases. This is one way. Or you can directly inhibit the renin enzyme. Okay, you can directly inhibit the renin enzyme with drugs like 𝐴𝐿-𝐴𝐶. Okay, 𝐴𝐿-𝐴𝐶 is a drug which will directly inhibit the renin. So no RAAS pathway, no BP. ACE inhibitors, ACE enzyme is inhibited, no RAAS pathway, no BP. And angiotensin receptor blockers. Now whenever you give angiotensin receptor blockers, angiotensin cannot act on not angiotensin. It's a aldosterone receptor blocker. So ARBs, aldosterone receptor blocker. Whenever you give drugs like ARBs, aldosterone receptors are blocked, aldosterone cannot act on the nephron, no sodium reabsorption, so no BP. So these are some ways, okay, to decrease the BP. Now after this, I want you to know a few more important points. See, this angiotensin II we have discussed. See, in the RAAS pathway, angiotensinogen will be converted into angiotensin I with the help of renin. This angiotensin I will be converted into angiotensin II with the help of ACE enzyme. Angiotensin converting enzyme is going to convert angiotensin I into angiotensin II in the lungs. Okay, so okay. Now, what this angiotensin II is doing, we have seen. Angiotensin II directly acts on the blood vessels, causes vasoconstriction, increases the BP. This we have already discussed. Not only that, see, this angiotensin II, okay, this angiotensin II, it causes efferent arteriolar vasoconstriction. Okay, some important points about angiotensin II. Why? Because in your exam, you can get a question something like this. All of the functions, okay, all of the following are the functions of angiotensin II, except kind of questions are possible. So, angiotensin II causes vasoconstriction, increases BP. We know it. Not only that, this angiotensin II, it is acting on the efferent arteriole. Okay, see, afferent arteriole brings the blood to the nephron. Afferent arteriole, it brings the blood to the nephron, and after filtration, efferent arteriole, it takes out the blood out of the nephron. So now this efferent arteriole is constricted by the angiotensin II. Later what happens if efferent arteriole constricts, what happens, that we will discuss later. So this is one of the action of angiotensin II. Not only that, this angiotensin II, see, it is acting on the PCT cell. Now angiotensin II, where it is doing, it is acting on the PCT cell. Okay, now what it will do by acting on the PCT cells, okay, by acting on the PCT cells, already we have discussed. Now angiotensin II, see, it increases sodium proton activity, Normally in the PCT cell, remember, in the PCT cell, there is this one transporter called as sodium proton ATPase. That sodium proton ATPase is very much important. Okay, it's very important for the reabsorption of bicarbonates. Okay, it is very important for the reabsorption of bicarbonates. Now this angiotensin II, what it is doing? Now it is increasing the activity of that protein. Now whenever there is increased activity of that protein, what happens? See, more bicarbonate, okay, more bicarbonate, sodium as well as more bicarbonates are reabsorbed. Okay, now, sir, angiotensin II acts on the PCT, helps in more reabsorption of bicarbonate. So angiotensin II increases bicarbonate reabsorption. True. Okay, angiotensin II increases the bicarbonate reabsorption. True. Angiotensin II causes vasoconstriction. True. Angiotensin II causes efferent arteriole or vasoconstriction. True. Now, angiotensin II, this one already we have discussed. Angiotensin II acts on zona glomerulosa of adrenal gland. Now, the zona glomerulosa of adrenal gland, what it will do? Zona glomerulosa of adrenal gland, it's going to produce aldosterone for us. That's already we have discussed. Okay, so angiotensin II acts on adrenal gland. What this adrenal gland is going to produce? Adrenal gland is going to produce aldosterone. Now what this aldosterone is going to do? Aldosterone, please concentrate. Now this aldosterone, okay, now this aldosterone, it will come. Now it will come to the nephron. Now in the nephron, what it is doing? See, in the nephron, aldosterone, now it will come to the nephron. Okay, this principal cell is a cell which is present in the collecting duct. Okay, this principal cell is a cell which is present in the distal convoluted tubule as well as the collecting ducts. Now this aldosterone, it will come here, it will act on the nephron cell. Okay, now it will act on the nephron cell. Now the nephron cell, under the influence of the aldosterone, it will reabsorb, see, it reabsorbs more sodium, see, more sodium reabsorption. Now let me put it this way. Now think that this is, okay, now this is the collecting duct, okay, collecting duct. Now these are the principal cells. Think that these are the principal cells. Okay, here are the principal cells. Now in between the principal cells, there are some cells called as the intercalated cells. Let me show you here itself. Okay, here is one cell which is called as the intercalated cell. Okay, principal cell, intercalated cell. Now we know, yes, aldosterone is coming. Now what this aldosterone is doing? Now aldosterone, now it will act on the principal cell. These are principal cells. Now under the influence of aldosterone, now these principal cells, okay, now these principal cells, they will reabsorb more sodium. Okay, more sodium is reabsorbed. Now when a positive ion is coming in, now one positive ion need to go out. So one sodium is coming in, now one potassium will go out, potassium will go out. So now tell me, aldosterone, it increases, okay, aldosterone increases the sodium reabsorption. Not only that, aldosterone increases the potassium excretion, or aldosterone increases potassium secretion. Potassium is going out of the body. So that's what the same thing. Aldosterone, say it is acting on the principal cell. Now on the principal cell, what it is doing? Increases the sodium reabsorption, but potassium is getting secreted, K plus secretion. Okay, K plus secretion. Okay, done. What else? Now this aldosterone, it will also act on, see, it is now also acting on this intercalated cells called as alpha intercalated cells. Now under the influence of aldosterone, now this alpha intercalated cells, what they will do? They will secrete the protons, they will throw the protons out of the body, or they will throw the protons into the body. So these are the three important functions of the aldosterone which you should never ever forget. Aldosterone, the mineralocorticoid, is going to act on both principal cells as well as the intercalated cells. By acting on the principal cells, aldosterone, first function, reabsorb the sodium. Along with sodium, water will be reabsorbed. Okay, but main function is sodium reabsorption. That's why mineralocorticoid, aldosterone mineralocorticoid, sodium reabsorption. And potassium excretion and proton excretion. So aldosterone, see, it is acting on the alpha intercalated cell. What it is doing? See, H plus secretion. Protons are going to go out. Okay, protons are going out. Okay, done. So vasoconstriction function completed. Efferent arteriolar constriction completed. Now this on the kidney and acting on the proximal convoluted tubule. Okay, now this angiotensin II, by acting on the proximal convoluted tubule, helps in reabsorption of bicarbonates. Completed. Now this angiotensin II acts on the adrenal gland. It acts on the adrenal gland, helps in the production of aldosterone. Now what this aldosterone will do? Aldosterone will act on the principal cells as well as intercalated cells. Aldosterone acting on intercalated cell and principal cell. By acting on intercalated cell, throws the protons out of the body. So proton secretion. Aldosterone, by acting on the principal cell, helps in reabsorption of sodium and excretion or secretion of potassium. And last one important function which I want you to know is this angiotensin II. Okay, angiotensin II will also go to the hypothalamus. There is this one nucleus called as the thirst center, lateral hypothalamic nucleus, which is called as the thirst center. Angiotensin II, by acting on the hypothalamus, stimulates the feeling of thirst. It stimulates the feeling of thirst. Why? Why? Because see, all the pathway, RAAS pathway, the main important function of the RAAS pathway is to increase. Okay, it's to increase the BP. Now angiotensin 1 converted into angiotensin 2. Angiotensin 2 go to the thalamus, hypothalamus. Now in the hypothalamus, it is stimulating the thirst center. Whenever there is a thirst, you are going to drink the water. Now when you drink the water, it increases the blood volume. When blood volume increases, BP increases. Okay, so we also have seen what are the important functions of this angiotensin 2 and aldosterone. Now let's see some important MCQs which are needed for RAAS pathway. Now look at the question. What are the stimulus for RAAS activation? I have already discussed with you. Whenever your BP is going down, RAAS pathway is activated. So hypotension is a stimulus. Okay, hypotension is a stimulus. Not only that, it's a sympathetic activation. Release of the norepinephrine onto the beta-1 adrenergic receptors is a stimulus for the RAAS pathway. So sympathetic activation or stimulation of the beta-1 receptors activates the RAAS pathway. Okay, done. Now whenever you are suffering with hyponatremia, RAAS pathway increases the sodium reabsorption. So whenever you are having hyponatremia, even hyponatremia triggers the RAAS pathway. Why? Because once RAAS pathway is activated, aldosterone is produced. Aldosterone is a mineralocorticoid which helps in reabsorption of sodium. Okay, so hyponatremia stimulates RAAS pathway. True. Okay. Now with this, the topic of Renin-Angiotensin-Aldosterone system is completed. Hope the video is helpful. Thank you.